and gentlemen, my name is Dr. Stephen Thomas, and I am so happy to introduce you to CommuniVax, our Prince George's County, Maryland Rapid Response Team, and our report back to the community. I'm a professor here in our Department of Health Policy and Management at the University of Maryland. I direct the Maryland Center for Health Equity. And I have my co-moderator here, Gloria Aparicio Blackwell. You'll meet her in a little bit. And I will introduce the rest of the panel when we come back to the Hollywood Squares. But for voice check, Gloria, can you hear me out there?
Yes. Hello, Dr. T. How are you doing? I'm so glad to be here again. This is an exciting evening.
Just in the green room, we had a chance of looking back to when this all started almost a year ago and meeting some of the young people behind the scenes helping us make this happen. Let's give a shout out to them.
That's a great opportunity for us to build the next leaders in this endeavor. We need more people to be talking about this and thinking about how we do much, much better if something like that, when does come back again.
Indeed. Gloria, we have one heck of a lineup tonight. Look at this panel we put together. Come on now.
Yes.
Now, before we bring them on the stage, and for everybody listening, we would like you to just take a moment and think about a word. Gloria, think about a word right now that best reflects how you're feeling in this moment in the pandemic. And in the chat, just write that word in. Don't hit return. Just write the word in, comma, word, comma, for just 30 seconds. And then I'll tell everyone I'll do a countdown for the actual word. Waterfall, that's what we call it, Gloria. Mm-hmm. So how have you been feeling?
I'm feeling grateful. After seeing those numbers, how many people have been impacted by COVID, we are here, we're still here. So I have to be grateful.
Indeed. And our lineup of speakers tonight includes Dr. Deneen Richmond, Dr. George Askew, Dr. Sandra Quinn, Dr. Joe Wright. We're going to bring them out in just a moment. I'm going to do your countdown now. 5, 4, 3, 2, 1, hit return. And behind the scenes, we have our students. They'll build that word cloud for us, and they'll let us know what we're thinking out there and what this audience is experiencing. So again, before I bring them on, let me just say, what is CommuniVax? There are 6 teams in different states, all under the leadership of Dr. Monica Shock-Spana and Emily Brunson. The CommuniVax Coalition is listening to Black and Hispanic individuals across the country. And you see there in our bullets what we're attempting to do to promote awareness and access and acceptability of the COVID-19 vaccine, and to develop longstanding local governance systems that enable underserved groups to exercise collective agency. Gloria, have we seen that also in the Latino community?
Yes, we have seen it. And like I said, this has been a work of love, of being connecting our communities and our immigrant community in all languages, in Spanish, in English, you name it. And I think this is what it is. We have to empower our community with knowledge, with science, with the facts. And this is the work that this group have been doing for all these months that we have behind, trying to educate, trying to get people to get the shot.
And no better place to learn how to do that than right here in Prince George's County, where the majority of the population is minority. And so I'm going to start at the end just to say, these are our recommendations, scholars out there, to utilize COVID-19 vaccination campaigns as a foundation for sustaining health promotion activities and community partnerships, to humanize the delivery and communication strategies for COVID-19 vaccines, to actually invest in strong public health infrastructure, properly staffed for sustained community engagement and public health preparedness, response, and recovery activities, and strengthen the community health system as a backbone for equity, resilience, and recovery. Gloria, these recommendations will help everybody.
And that's exactly right. And we're not asking too much. This is something that is done, but it has to be done through our community. Our community needs this kind of support. If not, we're going to be continue having the same deficiencies all these years and going through this this impact. So I think this is the moment. This is the moment to showcase that we are a model. We could be a model to the nation, having to explore, having to apply all these concepts, all these recommendations to get a better health and a better community out there.
So let's see what this audience is feeling. If you put that word cloud up, Meg, as soon as you can put that up, and we'll introduce our panelists. And we're going to start with, I'm looking at my Hollywood Squares. So I'm going to start with Deneen Richmond.
Hello, good evening, Dr. Thomas. It's so great to be here. And, you know, I'll just very quickly, I had 2 words, and well, I guess it's 3 total, but cautiously optimistic with where we are. But I think that one that I really want to stress and emphasize is connected. And that, I think, is we have definitely formed so many wonderful connections during this pandemic, and those are things that we need to carry forward. So thanks for having me this evening.
Very good. Next in my Hollywood Squares is Dr. Joseph Wright.
Good evening, Dr. Thomas and Dr. Quinn. It's so good to be with you all. And as a member of the faculty there at the University of Maryland School of Public Health, I couldn't be more proud of the CommuniVax project and all they've done over the course of the last year with this project and all the surrounding work around addressing vaccine confidence. And like Deneen, I am optimistic, but I'm also at a place of real anxiety, because as I'll talk about a little later on, we're really at a very critical point in the pandemic with regard to our children. And children under the age of 12 represent a significant portion of our population that are not only unvaccinated, but do not yet have the opportunity to be vaccinated. So when we are engaged in our discussion tonight, I'd like to really infuse the need to address our children, the needs of children, how we protect our children. So thank you, Dr. Thomas, and I'm delighted to be here.
Thank you. Thank you very, very much. Next in my Hollywood Squares is Dr. George Askew.
Good evening, everybody. It's always a pleasure to be here with you, Dr. Thomas, and you, Dr. Quinn, and my esteemed colleagues. This is everyone has said optimistic. I was going to say optimistic as well, and I will say optimistic. And I will say I'm concerned, and the reason I'm concerned is that while we've done great things here in the county, great things with the partnership of CommuniVax and great things with the partnership at the University of Maryland School of Public Health, we still have a bit of a ways to go with our Black and Brown population, mostly, particularly our Black and African American folks who have been out there getting vaccinated, but we still have a little bit of ways to go. And I want to make sure that we get to where we need to get to as we get further into the winter, further into the fall, so that we don't run into issues. The optimistic part for me is I think about where we were last year at this time. We did not have the vaccine in our arsenal. And we do now have the vaccine in our arsenal. You know, the drumbeat that I'm going to continue to beat throughout the evening will be, you know, this has become a pandemic of the unvaccinated. The vast majority of people who are in the hospital sick, the vast majority of the people who are still dying from COVID are people who are unvaccinated. At this point, I can't see any excuse. I want us all out there vaccinated as soon as possible.
Well, George, I cannot thank you enough for being here, and you're going to hear some things tonight that will lift up almost all these words here, and hopefully leave us with a path forward. Next in my Hollywood Squares is Dr. Sandra Quinn.
Thank you, Dr. Thomas, and thank you to the rest of the panelists. You know, one of the things about COVID that has been so striking to me is the enormous efforts that have been put in by county government, by ALMS, by Lumina's, Doctors Hospital, all of our healthcare providers and health systems and our community groups to get us where we are. And yes, we've got children to vaccinate, and we've got to get those who have not yet gotten vaccinated their vaccines. So we've got a ways to go, but I do believe that together we've gotten this far, and it's a long way from where we started, right, Dr. Askew? A long way, and we've gotten this far. So I'm happy to be here, and I think you're going to hear some of the ways that we heard from our participants, we've read in county reports, and we've heard from focus groups some of the ways that we might accelerate our success.
Thank you, Dr. Quinn. Gloria, am I missing anyone? Have I missed anyone?
No, you got everyone, and what a great panel that we're having this evening. And look at the words that are coming out. I know we are cautiously optimistic, but I love when we see that we're hopeful, we're grateful, and we're still worried, but that's something that is still remain out there. But what an exciting evening. I know that many people are looking forward to hear more about what is it that we need to be doing next. Winter is coming. What do we see in the horizon? And in the meantime, what precautions we can have as we are vaccinated, as we are thinking about getting the booster, as we have friends that don't believe in vaccination. How do we continue having these conversations and hopefully get to the positive result that we all want?
Indeed. And as we make this transition, look at worried, sandwiched by hopeful and grateful.
Yes.
That is our way forward. Okay, let's bring the cloud down. Thank you very, very much to everyone who participated. We find that as always a good starting point. And I'm going to ask Dr. Quinn to now give us, if this was a meal, Gloria, that's one of the things I miss when we're together. That would be like dessert. We have some dessert right there and appetizers. Now we got to have some vegetables. We need to have a confidence that the methodology that was used to deliver these recommendations is sound. And so Dr. Quinn's going to take us through that. And Dr. Quinn, I'll move your slides for you. The floor is yours.
Okay, thank you. So this was a rapid ethnographic project, and rapid being a really critical word here. We conducted 60 interviews, qualitative interviews with 22 participants from the county, all African-American, one identified Latino person, about their experiences in the pandemic, about their experiences and thoughts regarding vaccination. We had 3 focus groups, one with parents, one with healthcare providers, and one with faith leaders who have worked a lot with the county and a lot with the hospital systems to address this pandemic. We also talked with a number of key informants who serve in various roles in health systems, public health, and other parts of the county's government and organizations. We did lots of these virtual town halls, and everyone has been with us before, in which we heard a lot of questions, concerns. We also heard from legislators, local leaders, public health and healthcare providers. We did a human-centered design workshop with community members to begin to explore, if we thought about some personas, people kind of represented those in the county. How might we help move them along the path to vaccination? And then post-vaccination, what might we put in place to begin to build a community and health infrastructure that supports them after the pandemic? And finally, we began with, and we continue to this day with, an environmental scan. Which means we're looking at data provided by the county. We're looking at reports, many of the reports produced by Prince George's Forward, a task force that county executive also works created to address different aspects of the pandemic. So all of these things go into our data and go into our recommendations. Next slide. So we're going to focus initially on the the qualitative interviews, and they were largely female, as you can see, 68%. They were also about 40% who had incomes over 100,000, but 85% of them had income over 50,000. There was a range in ages, largely young in their 20s, 30s, and 40s. And importantly, over 80% of them lived with a family member. Why is that important? Is that we often heard that family members were in occupations that put them at risk. And family members were also one reason that one motivation for people making a decision about getting vaccinated. Next slide. So these are some of the zip codes that our participants were from, and it's about 43% of the 35 zip codes in the county. Next, please. And so we're going to start with sharing some of the perspectives from the individual interviewees. Next slide. Now, one of the things we heard, and it won't surprise any of us, is that the pandemic has weighed on all of us, and that while may weigh on us in similar ways, it's also different depending, and often even with families, within families. Everyone felt weight in some way, whether it was the economic burden, whether it's the isolation of staying home, whether it was the uncertainty. Many people, as we went through what was 2020 and a pretty traumatic year in a multitude of ways, every new thing they heard about in the news was part of, putting an added weight on. And yet we heard from a lot of the participants that they still felt like, compared to what many in the county and many in the community were suffering, that their weight was lighter than others who had been impacted by unemployment or disease in their families. And certainly having a sense of support from others, from loved ones or their church, variety of places also increased their ability to cope. But it was interesting, people also talked about things that gave them joy. Sometimes it was having extra time with children that they wouldn't have had. Some of them, it opened new opportunities to do things they hadn't done before. But there was also a bit of a mixture of those people who felt some guilt at, feeling joy, or guilt because they were able to work at home and were safe, but family members were essential employees, or another family member lost a job, but they had stable income. And there's kind of a mixture. Next slide. You could not talk to, participant after participant, we could not talk about the pandemic without racism. And as we went through 2020 and the murder of George Floyd and so many others, that was a theme that our participants came back to again and again. And, so they talk about the weight, the syndemic of those two things, the pandemic and racism. They also felt heavily impacted by isolation, social distancing that was required at different points in time. The hearing again and again across the nation about police brutality, about the hate crimes experienced by people, and empathy for Asian Americans who were really struggling with hate crimes during the pandemic. Those things just were an additional burden on people. And it just felt like month after month for many of our participants, they were just inundated with information that kind of reinforced to them that the world was a hard place for them and it wasn't a safe place for them. Next slide. So we tried to, we heard a lot. So I'm going to walk you through. This is not linear. We laid it out in a linear fashion to help kind of combine a lot of things very quickly. Certainly, we heard in terms of the systemic racism and the syndemics that people got oversaturated, both with information, but also emotionally. And so they would sometimes need to shut it off. Yet they saw some hopeful things They saw what they reported as increased support for Black-owned businesses, that in the recovery, they'd like to see that grow. They also, in the recovery, hope to see some of our existing healthcare structures, allocate some of their resources and effort to community health promotion. And we'll come back to that. Every school system probably, in the state and around the nation struggles with funding from time to time. And so participants talked about things like the county school system didn't have as much funding as they would like them to have. They certainly struggled, some of them, with learning from home and helping their children learn from home during the pandemic. And they were also really cognizant, both during the pandemic and recovery, that it would be really necessary to provide mental health support for both teachers and children, that some increased parental involvement. I think there's a sense many have that they never have appreciated teachers as much as they've learned to do in the last year and a half, and wanting to see more mental health resources inside schools. There was certainly, everyone talked about the existing health disparities that are well documented in the county. We all know, and Dr. Askew, Dr. Wright, Dr. Richmond spent a lot of time addressing. And there was a concern that we heard from people that, these disparities pre-existed the pandemic. And the concern that people voiced was, when the pandemic is over, interest in the health of our communities would go away again. That there was some, people who voice, this phrase that you only care about us now because we could potentially infect you. So, and that really led to, some of what you'll see later in recommendations as wanting to see expanded community health promotion, wanting to see some of the interests sustained beyond the pandemic. There was also concern about myths and misinformation, and particularly how they were often targeting Black and Brown communities, and wanting to see increased way to address that increased presence of credible, available information. Next, please. People talked a lot about what we've grouped here as kind of the social determinants of health that existed prior to the pandemic, that we have a substantial proportion of essential workers in the county, that we know that housing costs are often high, and that we have some overcrowded housing. And then when the pandemic came along, some of the impacts of that were people who may have lost their job and lost an apartment, contributing to overcrowding, for example. People talked about job loss and trouble getting unemployment benefits, which was something we've heard, certainly more broadly across the country and across the state. And, a desire for integrating the breadth of services that a family might need, from services helping with housing, with employment, with job skill development, with education, and with health. There was also, kind of the emotional impacts of staying at home, the fear and the stress and the grief and the loss. And that drove a lot of the desire for more mental health resources. And people talked about what the county, and Dr. Wright was around when we did, a report in 2012 that documented what was happening at that time, which was a lot of people seeking healthcare outside the county, and that some still reported having a lack of a medical home and having both concerns about historic and contemporary experiences of bias. They talk some about avoiding ERs, not so much just for those reasons, but for fear of getting infected. We're at a different place in the county today with a new hospital, with expansion in Luminous, with a number of other systems in place and places for care that will change that picture. But that's what people brought into the pandemic, and certainly wanting to see some of those new and existing resources allocated for ongoing delivery of health promotion out in community settings. Next, please. And I just want to say, you know, what we all know, but I think it bears reporting, a lot of our data collection was really in the first 6 months of this year. And so, you know, we all know we in the county experienced challenges, as did the state, as did much of the country. The governor quickly moved us in terms of expanding eligibility without really an additional doses and increased supply. That created challenges for demand without opportunities to get vaccine. There was also at different points in time, and I know Dr. Askew and Wright know this far better than I, uncertainty about supply. We certainly did, as did the state, as did others, rely on online systems for registration, and that presented challenges as well. And then we all know, you know, the hallmark of a pandemic is uncertainty and changing information. All those things, you know, led to some initial frustrations with the inability to get appointments, confusion about, you know, where do I get information about the different sites? And then some concerns that some of the sites were not accessible to people who needed public transportation. And there was some initial concern. I think many people didn't understand Six Flags was a state clinic that served more than Prince George's residents. And so it led to a concern that the sites were not sensitive to the needs of communities, or, you know, or because they weren't on bus routes or more, you know, local, you know, in communities. And many of these things over time smoothed out and got resolved, and we'll talk about those things more a little bit later. The health, I'll just say one more thing. The health department, Dr. Askew certainly knows this well because he spearheaded this, really began to shift a focus to a social justice perspective, doing door-to-door outreach in some of the neighborhoods that required really special attention. And part of that was also addressing other needs that families had, along with providing access to the vaccine. And so there were also growing over time as more vaccine became available. There was also more connections between the health department, the hospital systems, churches, our beauty and barber shops, and other places to provide clinics out in communities and places people go, like their church, for example. So some early challenges that were commonly felt, and some changes over time to help to address some of those challenges. Next, please.
So, you know, it's interesting that the pandemic also brought us together, because it broke down some barriers and silos, and this is how we usually do things. And we came together, and that got us closer to the people. And so when we look at some of the themes that emerged with the folks that actually got vaccinated, you know, you had the early adopters, the folks who couldn't wait. You know, they're hitting return, refresh. They couldn't wait to get their shot. And then that early majority, some of those were watchful waiters. I hope most of them have gotten vaccinated. Most of them have gotten vaccinated now. They wanted to wait a little bit, but finally got vaccinated. We've got this big group. And then in the middle, look at those overlapping motivations. Safety of others was a strong motivator. This is important for what the communication strategies that can move the needle. They weighed the risk and benefits of the vaccine. So we had to educate our community more about risk benefit. They were comforted by high profile individuals getting the vaccine publicly. That was, and continues to this day. But how about those people, as you said, who are the unvaccinated? Here's what we learned so far here in the county, and they too need unique communication strategies. The unvaccinated participants, and this is right from our community, not yet vaccinated, they plan to do it. You may have some of these folks in your family. I plan to do it, just haven't done it yet. Waiting for a specific type of vaccine. We found that J&J was kind of radioactive at some point. That has changed over time, but early on, if you only brought J&J, it was a barrier. Not wanting to jump in line in front of other people, actually being concerned for some of those who had more difficulty and recognizing that they did have some privilege. So unvaccinated, those still undecided. I'm healthy, I'll take care of myself, I'll eat better, I'll lose weight. We know them. And then those who do not value the vaccine itself. That we're not saying this is anti-vaxxers, but they are skeptics. They're skeptics. And our strategy, hopefully, is to treat each of them with targeted communication that reflects dignity and respect. And that's one of the challenges that we have, because we're frustrated that we're in this situation. And if we recognize the other barriers around the individual, the things the individual cannot control, this is where I think that we can help put our forces together in the institutions in which we're operating. The barriers to access, Dr. Quinn went over several of those. We now know things. We knocked down some walls to make it easier to get to the community. Let's keep those walls down. And then look at the facilitators of the vaccine for access. Schools, workplaces, social support, community engagement. We have our medical systems now working at the grassroots level with their mobile units. That's great. These are things we want to keep going. Dr. Quinn, as you take us to the finish line of our formal presentation. Unmute yourself.
You would think I know that by now, right? So part of CommuniVax was actually to also think beyond the moment, to think about recovery. So I just want to hit, and I'll do this as quickly as I can, some of the themes and areas that came up. Next slide, please. So what we had was we heard about children, particularly from our parents' focus group. And they talked about concern about underfunding of the education system. But they also recognized that, you know, the school system was offering a lot of services that in the midst of the pandemic, suddenly were seriously missing from families. Certain meal programs, obviously, and there were certainly huge efforts to provide meals to children. Laundry services. I did not know, Dr. Askew, that there are 9 schools in Prince George's County that have laundry services for kids who are homeless or may not have access, and other family services that were important. They really felt strongly about the need to provide teachers with more tools to work with mental health and more parental and parental and teacher involvement. And one parent said, I've learned a lot about what's actually going on in the school system, how much the school systems have been dependent on to provide services other than educational and not funding the school system. Next slide. A lot of people talked about, obviously, the importance of vaccination as, you know, one way that we are going to get back to normal. But for many, normal was not very good. And so as we come through the pandemic, there's been an emotional toll that still weighs on people. There's been fiction in many of our families about getting vaccinated, about wearing masks, and the kinds of things we need to do to mitigate the pandemic. There has been some existing and in some cases people talked about exacerbated lack of confidence in some of our local healthcare facilities. And certainly people talk about financial impacts, having to move into families, long waits for relief funds that were, you know, that impacted people in a serious way. Next slide. But they also talked about what they wanted for the future. So building a just system, more intentional support for public health and policy making at all levels of government, using some of the systemic changes that have been put into place during the pandemic to restructure some county services. Really is this to think about how can we be more interconnected as we go forward, and creating more space for community voices in county decision-making. They talked about wanting to build ongoing engagement and trusting relationship with county government, county organizations, and groups, and not returning to normal. That normal wasn't good enough for everyone. And so that is, the statement here, this is a permanent wake-up call with respect to what needs to happen in communities that have been disinvested in, communities that have been forgotten with respect to health and human service. This is not the last disaster, the last pandemic, the last epidemic we're going to see. And unless we're better prepared going in, we're going to end up with the same results. We're going to end up with Black and brown people getting sick and dying. Next slide. And these were some of their hopes, that to get where we need to go, that we really find new and innovative ways to address misinformation, that we increase the communication with community members about social service, social support system. People talked interestingly about personal hygiene and really bringing an emphasis back that outlasts the pandemic. And the need for more community connection and more action and more empathy were things that people talked about, as well as continuing through the county and elsewhere to support Black-owned businesses and entrepreneurs. All of these things really led us to our recommendation, using the data, using the voices, using the reports, and that led us to the recommendations. And many of these recommendations, and I'm going to turn over to Dr. Thomas, what we call for in a report is it's a cast of actors. It's county government for sure. It's our hospital systems. It's our churches. It's a whole array of actors as working as one that will need to move us forward. Dr. Thomas?
And the quote that you read, you could hear the passion in the person's narrative jump right off the page as you read it. And I would say to the panelists, that's energy we can channel. You got the community ready to get engaged. They want to get involved. And now let's channel that energy. Some of these recommendations could be the way that we move forward. And we group them into categories. This is the first set. Urgent action to curb the COVID-19 surge. We need to do this like yesterday. We need to be on top of this. Utilize COVID-19 vaccination campaigns as the foundation for sustained health promotion activities with community partners. Think about this as we get ready to get into the discussion. We found this. Identify those vulnerable populations. Those heat maps? We now have those heat maps right down to the neighborhood zip code level. And we were directing vaccinations right there. That's powerful. We could do that for other issues that have been raised in our interviews, like some of the chronic diseases. Strengthen the partnerships with the multiple and other services, pressing health needs that the community says, don't abandon us. They're ready to also help. Secure commitments of major hospitals. I, Gloria, have seen hospital executives out in the community saying we are committed to doing a different way of engagement.
Yes.
And Gloria, guess what? The phone's ringing off the hook. Can we bring our mobile unit to your barbershops?
Mhm.
That's great. We want to keep that going. And look what they did even in Langley Park, all over, even in the Latino community. These things help everyone.
And Dr. T, and that's what it is the working together and building that trust. If they see that hospital, the people working in those hospitals coming to their community, building those relationships, is not just a one-time deal. They are there taking the pulse and bringing the resources. That's what that is what community is all about.
And you know what? When I see some of those health professionals, They were smiling. They enjoyed being out in the community.
And listening to all those different languages that are coming, and they said, "My goodness, well, where are we?" And that's the beauty of our region.
You're absolutely right. That is the beauty of Prince George's County. Secure commitments from major hospital systems for sustained health promotion activities. And Dr. Richmond, part of it is how do we have the right plugs so that a local church or a barbershop can actually be plugged in to the hospital system. Sometimes that means we need to upgrade their systems in the community to be able to have that level of engagement. Another one, humanized delivery of communication strategies for COVID-19 vaccines. Very important. And that means as the access has increased, a lot of the problems have decreased. But look at this development of the mobile pop-up clinic and the vaccine pods. That's been great. I'd love to see that built upon and strengthened. How do we make that happen? Co-locating vaccines with other services, food banks, WIC. It just makes a lot of sense. And we could have done these things before the pandemic, and maybe at some level, Gloria, they were happening. But when it came right down to getting the last mile communities, getting people vaccinated, getting hyper local, these were the things we had to put in place. Ensure that residents have access to systems to schedule appointments. I'm hoping that as a result of working with these communities, they have better computer skills to interact with their health portal and other kinds of things. So there's some good that can come from the bumps in the road.
And Dr. Thomas, one thing that are going to be emphasized here, and Dr. Quinn mentioned the faith-based community. I'm going to give a shout out to the nonprofit organizations.
Mm-hmm.
Those groups has been key because they're already in the community, building that trust. And what a best way for us to be working with that group and really connecting and bringing the resources. That's what we need to start building, those relationships.
And I want the county to know that by helping groups like Community Ministries of Prince George's County, the reason Jimmy Slade's not here right now, he's presenting on the prostate cancer men's health Zoom. They're using Zoom to engage the community. And then he says to me, I have a meeting with the CDC. We have increased the capacity of nonprofits in Prince George's County to compete locally and nationally. That's a good thing.
Yes, the Latin American Youth Center have done a lot of work on this, and also the Kenilworth, Central Kenilworth corridor. They are bringing resources, so we have the people right here. It's just a matter to connect and expand.
Now look at this. Ensure that the health department has the ability to translate all COVID vaccine materials into all the languages spoken, and you can see the rest of that paragraph. Over the weekend, Gloria, we delivered resources to Afghan families moving into Prince George's County. When I put the address in the GPS, it was 8 minutes away. 8 minutes away, I was in a completely different neighborhood, multiple languages, people from all over the world right here in our county. And that's very unique. Very unique. We need to lift that up as the other level of diversity. And it's an added challenge to address all the different languages that exist in the county.
And you know what? That's the reason what we need to talk to the school system, that we can preserve. We should preserve other languages so people don't lose that. The kids, if they're coming with another language, let's embrace that. Because that could be another way for us to getting involved in this and be the translators and be the interpreters. Strengthen
public access, the websites, vaccine activities for Prince George's County. All this has gotten much better because we have driven a lot of our community folks to get online. And by adapting to what their needs are, we've gotten better in our websites and delivering information electronically. Okay, I'm going to head to the finish line. These are the essential actions for ongoing health equity, and they include investing in strong public health infrastructure. You'll see the bullets popping up here. The main thing is that preparedness cannot stop. this is a beginning, not an end. And this particular virus, Gloria, may well be with us endemically. We'll talk about that in the discussion. And so these are some of the granular details under each of the recommendations.
Dr. Thomas, can I jump in here too?
Please.
Yeah, I mean, one of the things that Prince George's was not alone in experiencing, we have a pandemic, and we have had a consistent challenge with funding public health across the nation. It's been going on for decades. And so one of the things that we heard in the Prince George's Forward report, and even some of the county's reports, was the importance of stabilizing and increasing. And there has been an increase written into the new budget. And now it's talking about what are some of the other things that the county and General Assembly and community partners working with the county council to give a voice for what the health department and other agencies can use to be stronger over time, not just for this moment, but over time.
And we have some really champions in the legislature. Some of the new legislation actually has funding behind it. And so when they are able to deliver like that, and it aligns with these kinds of recommendations, let's lift them up as well. In fact, we have a legislative briefing planned later on before the end of the year. Fourth, strengthen the community health system as the backbone for equity, resilience, and recovery. You can see the bullet points here, Gloria. And as you have all, as panelists, seen the granular details under these recommendations, you get an idea of some of the things we want to have in the discussion. I'll just pull one thing out here, and that is to create and support community influencer program with existing trusted health messengers. Not just a message, it's the messenger. We can give some of them some media training, and they can be voices at the grassroots level to amplify the message.
Let me just,
sure, please.
I was just going to jump in with one other thing, that one of the things that we saw in Prince George's Forward report and in other places, is we saw in the General Assembly the adoption of 3 pieces of legislation, all addressing issues related to health equity in the last session. And many of those things are corresponding to plans that the county has had, and now can, hopefully working together with others, see some of these opportunities for new funding that would support things like the community influencers. But the other thing that Prince George's Forward did, I thought, a really comprehensive look at where we need to go. And this may be a question Dr. Askew may know more about, I'm sure knows more about than I do, but that is, have we stood up, or are there plans to stand up, a body like Prince George's Forward, or something that would engage communities and focus on recovery going forward? So we've got, I think, a lot of opportunities here, of community engagement, legislative support, things that the county has had underway for a while, like moving toward health and all policies. And now how do we sort of bring them together?
And now there's echoing support from the state. There's legislation that was passed to create the Health Equity Task Force at the state level and Health Disparity Task Force at the state level. They're bringing back a version of the health enterprise zones. So I think Prince George's County is poised to be a model for the nation. And Gloria, what a panel we have to open up. Have we set a table, or what? You had
oh my goodness,
appetizers,
you have the vegetables, you have the dessert, you have everything ready for the panelists here to react. And I know they have a lot to contribute, because they are the ones who have led all these efforts as well. And what excitement it is to hear from them too.
Okay, so let's open up the floor. And let me begin with Deneen Richmond. I have been so pleased to work with you at Doctors Community Hospital, and now part of the Luminous Health System, and to see you out in the community. The floor is yours for your initial reflections.
Sure. So thank you, Dr. Thomas and Dr. Blackwell and Dr. Quinn. So first, quick disclaimer, I've been referenced as doctor a couple of times, so I will have to put out there, I'm not a physician, but I am a true healthcare advocate, and that's the way I like to think about myself. So, every point that you just made and everything that you captured in the report is totally right on the mark. And, when we think about, this whole focus on the communities, I think if we think about, well, why do we even have healthcare services, right? It's to serve the communities that we're privileged to serve. At Luminous Health, it's right front and center in our mission statement. Our mission is to enhance the health of the people and communities we serve. And I think what we have to recognize sometimes is that we got to get out of our way around providing care and services and truly focusing on, are we making a difference? Are we enhancing the health? And we can't do that just behind our four walls. We have to be out in the community. So we have been, we wish there wasn't a pandemic, but since we didn't bring on the pandemic, we said we're going to do everything that we absolutely can and be responsible to lead the way in ending the pandemic. So that's where a lot of our focus has been. And it started so long ago. As I was listening to you, you kind of took me down the memory lane there. And, it was March of 2020 when, think about it, we had this new novel virus. None of us really didn't know what it was, how it got transmitted. We didn't have any vaccines. We had schools closing, people going home. And being isolated and not getting information or knowing where to turn for information. And so I think that was the first thing we recognized, is that there were voids in the usual ways. You talked a lot about communication. There were true voids in the usual ways that we communicate to get information out to people. And, not everybody has internet access. Not everybody was listening to the evening news or going to our websites or going to the health department's website. So we had to be very creative and look at other ways to really communicate with people and get the word out there. So one of the things that we did, as I like to say, as everybody else was running home, we ran out into the community with our community health team and seniors and our vulnerable populations and low-income populations, and really just started providing education and information about COVID and about even then what we knew people could do to stay safe and when they needed to get tested and even basic things. I think, it seems like it wasn't that long ago when I can remember that, I never thought I would ever have to stand in line outside of a grocery store to be able to go in and purchase groceries, and then going into that grocery store and not having the shelves bare of things that we just took for granted: hand sanitizer, soap, laundry pods, all different types of things. You couldn't find masks, and that's in the community. And then we faced our own challenges with personal protective equipment, or PPE, as everyone refers to it now, and we're trying to make sure that we were keeping our staff safe. And so that was an experience that I don't think any of us thought we would ever go through in our lifetimes. I know I didn't. So just being able to address that, we were very fortunate in Prince George's County to reach over 30,000 people with just education and what we called our COVID care kits.
Let's give them some snaps. That's great. That's awesome.
So, and it's what we needed to do. It's what we should be doing, not just around COVID, but how we know we can provide education on a number of things. And then we had the vaccines. And I like to say at the beginning, I call it the Hunger Games. If anybody is familiar with that, that's what it was like. You had people literally, clamoring to get the vaccine, and, once again, lines and chaos and all kinds of things. But I think the one area, and you hit on this a little bit, where I think that if we take a look back and say, well, what could we do different? Right at that same time when there was not enough vaccine and we had the Hunger Games going on, the media was extremely focused on talking about hesitancy. And I think what we found during that time, though, was that, the media has a lot of influence and power. And so if every time you turned on the news, all you heard was hesitancy, I think we actually made people more hesitant because people were like, well, is there a reason why I shouldn't be clamoring, to get this vaccine? Is it safe? Why are we talking about it? So I think the next thing we really had to do, and we were very fortunate to do, was to get out there and change the narrative. And I think that was so important to make sure that all of the chatter and the noise wasn't all about hesitancy, but really saying, how do we make this vaccine accessible? How do we educate people about, how it was formed, why it wasn't rushed, why it's, safe to take, and all of the clinical trials and everything else that led up to it being widely available to the public, and then making it accessible. So we went and partnered with a number of different community partners, Reed Temple in Glendale, Maryland, Prince George's Community College, First United Methodist Church of Hyattsville. And those were very successful sites. And we were able to give, over 1,500, 2,000 vaccines a day. I mean, we got it down to a science. But then we realized that, as you mentioned, even those sites weren't perfect. Some of them were, like First United is, smack in Hyattsville, which was one of the most impacted areas within Prince George's County, and accessible to public transportation. But we also learned that, people couldn't figure out how to make appointments. So we said, okay, we need to make it no appointment necessary, no doctor's order necessary, walk up and drive up testing, because everybody didn't have a car, and everything up until that point was drive up testing. And we had a lot of people saying this will never work. Thankfully, we didn't listen to them, and we made it work. And we couldn't have made it work without some key partners. And that's what I'm so grateful for. We had the church that opened our doors, is still open. We're still offering vaccines there. Definitely have to give a huge shout out here to my friend, Dr. Askew. The county has been right there with the labs and the testing, and just supporting us through being able to continue to have that site open for not just vaccines, but testing as well. And the last thing I just want to make really quickly, because I know my colleagues have a lot to share too, is just all of the other, I want to call them the side effects of what we've learned during this pandemic. So I just want to quickly mention two. One is the mental health, and that you highlighted that as well. It was always an issue. But the stress, and as you talked about, the anxiety and everything that people have had to deal with during the pandemic just brought it front and center. And we know that that's another great need here in the county. And we are very fortunate that at Luminous Health Doctors Community Medical Center, we are building a full pavilion just for behavioral health services, ambulatory. And last week, we got approval from the Maryland Healthcare Commission for our certificate of need for a 16-bed adult inpatient unit. And once again,
some snaps.
Snap away. That took a huge partnership, including our county. Once again, huge props and thanks to our county executive, the health department, the mental health division, and many others that even made some of that possible through a very generous $20 million grant for the capital, that's largely covering a lot of the capital expenses. And so we got to make sure that we really integrate as we think about moving forward, not just regular healthcare, medical care, but behavioral healthcare. And the last thing, and I promise it's the last thing for now, I want to quickly mention, is the other side effect that came right in front to the center that you also mentioned was racism. And once again, it wasn't new, but all of the things that happened, both with the pandemic and the disparities that we were seeing, and then with the murder of George Floyd, just brought that once again front and center too. And I'm very proud in my organization, we took this opportunity. We've always been working on health equity, but we took this opportunity to form what we call a HEART force. And it does speak to my heart. HEART stands for the Health Equity and Anti-Racism Task Force. And now our board in June has approved a broad set of recommendations that we are putting all of the action steps around that will focus on, our staff, our diversity and inclusion of our staff. It will focus on the community. It will focus on patients, everything around. We actually are calling it now our JEDI movement for justice, equity, diversity and inclusion. So we are going to be Jedis, and there's so much work that we can do and have to continue to do together with everyone in this community.
You know, President Richmond, as I'm looking through the Hollywood squares, I'm realizing that you're my newest colleague, and we're just one big happy family here. So I'm going to call you Deneen. I'll be Stephen as we move through the rest of the night. Gloria, was that amazing or what?
Oh my God, I was just walking through the whole what she was describing, and that's exactly what we live. And
Yes.
and we commend you. And as a matter of fact, someone is commenting here in the chat that could we do this? Could we continue doing this personalized medicine care, going out and be there, not just for COVID, but for now moving on. So that will be a very important to keep in mind, that personal touch, being in the community, is critical.
Okay, so the culture matters, not just the delivery of the care, but the cultural context in which it's delivered, and these new relationships. I just love, as the county was also a partner. I'm saying that the models coming out of Maryland, out of Prince George's, can help the nation. George Askew.
Dr. Thomas, one more quick thing. I obviously cannot forget about you. Dr. Thomas has with his partnership, we have been in barbershops and beauty salons, and it has been just awesome to reach people where they are and to leverage, you know, the barbers, those trusted voices, and the stylists, and the clients that they have the relationships with. And so that has just been an awesome experience. So thank you. I'm so grateful for your partnership.
Thank you. And they're out in the audience. And I'll mention that two of them will be presenting at a national meeting, George and Joe, at a national meeting in the morning and an international meeting in the afternoon. It's been amazing. George, you're on, my friend. Yeah, your reaction to the report, the recommendations, your colleague, Deneen, has just shared some amazing results of your partnership together. It all benefits the health of people in Prince George's County.
Well, you know, it has been quite a ride. And I'm going to start off with a number, and then maybe work through just a couple of things, because I know you've got some tremendous people still yet to go and share the thinking. 1 million. This week, as of this week, we have delivered over 1 million vaccinations.
Snap it up. Come on now, Prince George's.
when we first started the vaccination rollout, and we looked at the numbers we had to reach in order to achieve our goals for vaccination in the county, the figure I came up with was 1.2 million. And when I thought of that number, I was like, how the heck are we going to get 1.2 million vaccinations into people's arms? And lo and behold, we have now surpassed 1 million as of this week, and we are going to hit that 1.2 million certainly, and we'll likely go well beyond that now with boosters being available. So I want to start off with that number, and it's a great sense of pride. You know, I've been fortunate during the pandemic to have a legislator, an elected, a county executive who has listened to the science at all turns. I think if you look at how things turned out in other places, and places that are still having difficulties, there's places where folks didn't listen to the science, and you had leaders who were the ones who really had the decision-making power in their hands, who did not listen to their public health advisors. And thank goodness our county executive, Angela Also Brooks, did and continues to this day. I think back on April of last year, I wrote an op-ed piece for the Washington Informer. And in that op-ed piece, I said that I was not surprised that Black and brown people were suffering the brunt of the COVID outbreak, the COVID pandemic, and neither should anyone else be. You know, the folks who are suffering most before a pandemic, a disaster, an epidemic, any other mass casualty event are going to be the same folks who suffer most during that event, and the folks who are going to suffer most after, unless you do something different. things have been done, and interventions made during the pandemic. My fear, just like some of the folks in the community who were interviewed, is that we have a short memory in this country, and it's very easy for us to forget where we were and what the conditions were and what the investments were that we made to bring us out of this. For us in the county, and something that CommuniVax work has certainly helped with, is that everything from testing to rollout all started with equal proportions and looking at equality and not looking at equity. And there's a big difference between equality and equity. Equality is giving everybody, no matter what your condition, no matter what your starting point is, the same amount, because that feels good to people. That feels good to people making decisions that, well, I can give, if I've got 100 chairs or something and I've got 50 people, everybody's going to get 2, and everybody should be happy with that. Well, the truth of the matter is, you have to do things in ways that are equitable, and being equitable really means giving folks what they need to assure the greatest opportunity to achieve the success that you're trying to achieve. And that means that sometimes there are folks who need to get more, that there are folks who need to get 3 shares while others get 1. And not by, it's not that, by any fault of their own. It's a system that has been created through, in our case, there's systemic and structural racism that impacts even a great county like Prince George's County, where we have, the most affluent majority Black and Brown county in the country. But we still have Black and Brown people who have grown up in this country and suffer the consequences of having done so. We spent a lot of time working initially talking to the governor and pushing the governor and the state to move towards a more equitable distribution of resources rather than equal distribution of resources. And once that was achieved, we were able to also then, develop a plan for locating services in areas that were the most needy. Getting the mass vaccination site at Six Flags was no small achievement, and our county executive fought very hard not just to have it here, but then to also say, well, this is right in our own backyard. We are needy. We need to receive some more of these services, and we actually carved out greater numbers of appointments for Prince Georgians. So again, it paid off. It certainly paid off in the end. And I'm just going to jump to sort of one of the last things that you talked about. I'm glad that you recognize the Prince George's Forward Task Force and the information that's there and the work that was put forward there and the recommendations that are coming out of that task force. Dr. Wright was a key member and leader of that Prince George's Forward Task Force on the health side. We thank him for his leadership there. And one of the things that came up was, after this, after this winter of pandemic, we were coming into a budget season where businesses were closed and the revenue was down, and tough decisions had to be made about budgets. And in any other time, any other year, any other circumstance, the brunt of that, any budget cuts or any budget shortfall would have fallen on the Department of Health and our human services agencies. That did not happen this year. There were no cuts. In fact, there were greater resources, that increased staffing, millions of dollars put into our health assurance fund, which helps to take care of uncompensated care, which will go out to our fairly qualified health centers. And again, not cut. Whereas other places were cut. So I think the future looks bright for Prince George's County. We're watching right now, our numbers start to go down. When we look across the country at what we were able to do in our communities, our communities of color, compared to what's happened in other parts of the country, it makes me very proud. So when I said at the beginning, I'm concerned, I'm concerned because I know we can do better because this is Prince George's. But when we compare Prince George's to other places that are somewhat similar, there's no comparison. And thank you all for your partnership. There are lots of elected officials, particularly our officials in the predominantly Latinx community, who really did a tremendous job of getting our Latinx community out to be vaccinated. We actually have the highest percentage of folks in the county vaccinated are among our Latinx population. So it's really, again, a source of pride for us. So there's so much more that I could talk about. There's so much that has happened. And there's many more great stories to be told, but thank you for all of this work. Thank you for the opportunity to share our successes here in the county, but also to share, what needs to happen in the future. Let's not have a short memory about what it took to get out of this as we come to the light at the end of the tunnel.
Well, that's why I'm looking at that cloud and being so encouraged, Gloria. And with Dr. Deneen brought the light into the tunnel.
Yeah, yes.
Brought the hospital system to the barbershop. George, thank you so much. And I'm looking at Joe, realizing, hey, Joe, we were hanging out together before Deneen came on the scene and before Joe and before George arrived. And now look what has happened in the 10 years we've been hanging out. The healthcare infrastructure in Prince George's County has been amazing. What did you take away from our report and the recommendations that might move us forward, Joe? Your reflections, my friend.
Yes, thank you. Thank you, Dr. Thomas. I jotted down some points as you and Dr. Quinn were moving through the presentation, specifically in the recommendation phase. And, one thing that has been striking in the communication domain is the dynamism of the pandemic. It's been withering because the information has been so changing every day. And that staying the course with communication, as you've emphasized as part of the recommendations, I think is something that jumps out. Having a consistency, a template, if you will, to build off of, because I know that the 28,000 member workforce in the University of Maryland medical system, we struggle with the town halls that have shifting information each time that we get before the workforce. Even just today, I participated in a presentation in which the information with regard to boosters and such is a moving target. And I think that, so I take away the fact that we need these kinds of guardrails and this kind of experience that the CommuniVax project has been about from the beginning to really shore up our communicators and our trusted voices to really deal with what is an ever-changing landscape. Because remember, George, when we first started talking about the advent of herd immunity, we were like, let's get to 70%, we'll be good, right? Remember that? Well, guess what? The county is at 70% for those vaccinated 12 years of age and older. But guess what? The goalposts have changed, right? The goalpost as a result of Delta has really pushed what we need to do to get to a place of safety for our community. And so that's a perfect example of where just a few months ago, we were communicating a message that today is not only not relevant, but we've got to assure the community and ensure confidence that we can get to a place of safety. So that jumped out, Stephen. The other thing that really jumped out, I want to make sure I hit this, and you emphasized it, is the opportunity in Prince George's County and in Maryland writ large, because of the payment structure for health systems and hospitals. We have an opportunity here when we talk about the total cost of care for which Deneen, myself, and our partners in the health systems are responsible for. This is a perfect platform to demonstrate how we both look back and look forward and embrace what's coming through the doors of our hospitals in a way that is a win-win. Because if we do this right, a rising tide floats all boats. And Maryland is unique in that regard. And Dr. Thomas, as a commissioner, a former commissioner, you know this. You know that the opportunity here, particularly as the waiver, the Medicare waiver, we're not going to get into the details of that tonight, but as we are approaching the next phase of renewal of that waiver, I think that this activity through the pandemic will help inform all of us as we prepare for that next phase of being responsible for the total cost of care in the state of Maryland. So there's a great opportunity that I think this project will help to inform. I also jotted down something that you referenced with regard to upgrading the digital divide that we experience as we're going out into the communities, particularly with our mobile efforts. I will tell you that and share with the audience tonight that regardless of the access point, anybody who's vaccinated in the state of Maryland, or frankly, anywhere in the country, it needs to be registered. In the state of Maryland, it's a database called Immunet. And so that requirement has forced us to really engage community partners, particularly in our mobile and pop-up sites, to become better skilled over the course of time with registration, documentation, and then ultimately being able, particularly now where we're getting to a phase where if folks are in places of employ, where the need to demonstrate vaccination as a requirement of employment, this kind of skill is necessary no matter what the access point is. And so that jumped out to me, Stephen. That is certainly something that we need to continue to amplify at the community levels. We also talked about I mentioned at the outset of my opening remarks that the proportion of the unvaccinated that are children really give me pause at this moment in particular. As we sit here, 28% of all new cases of COVID in this country are in children. That is a percentage that has been higher than at any point during the pandemic. And it's a function of several factors, but not the least of which is the return to in-person K through 12 school. And we're really just on the verge of seeing the impact of that right now. But I want to say that the efforts to address vaccine confidence at the family level, and Dr. Quinn, as the chair of family science, I want to emphasize what we are seeing in our health system is families coming in together, and the children who are testing positive in our health system, and I'm sure the same thing that Deneen is experiencing, have largely been a part of family units, where someone's concerned about an adult, they bring the kids in, and we're able to address the need to protect families as a whole. And one of the things that you mentioned, Stephen, that jumped out when you talked about the vaccine hesitancy is really not understanding the importance of protecting those in our households, where we worship, where we play, and the challenge and the vulnerability right now of children under the age of 12. Even though the phase 3 trials have been completed, it's still several weeks away before we really are going to be able to get needles into arms for children between the ages of 5 and 12. So I want to just emphasize to the audience, particularly as we are on the verge or in the midst of a flu season, that we need to protect ourselves and our children, if nothing else, through vaccinating those adults who can be vaccinated, who are eligible, and thereby protecting those who can't be vaccinated, our children under the age of 12. And that's something that we're watching very closely with the county and all of us around the state. And let me just close with this. I think that the opportunity here, and Stephen, you hit it best. We need to be unapologetic in our commitment to equity and unwinding 400 years of systemic and structural inequity. And you know, this is a unique place. There are unique dynamics in the how even the history of Prince George's County came to be.
Yes.
That we don't have time to get into tonight, but these are all issues that have been laid bare through the pandemic, and certainly this project has put the voice of the people up front. And I love the crosswalk between these recommendations and the Prince George's Forward Task Force recommendations. Fantastic. This is a whole that's greater than the sum of its individual parts. So thank you so much for this and the opportunity tonight. And you know, Dr. Thomas, even though these newbies here, you know, they
should have been around when we were doing
Yeah, but you know what they say, there are a few degrees of separation. Deneen and I go way back, and George and I also share a lot, even before we were all working together here in the county. So it's great to have a team like this on board. And so thank you, Dr. Quinn, Dr. Thomas. Great project and great program tonight.
Well, Joe, I can't thank you enough for that. And there are people out in the audience putting in comments. We are onto something, all of the panelists, in terms of Prince George's being a model. And here's one of the comments I'm going to read, and I want my team to get ready to put up the first poll. This is from Ronika. What a precedent for how customized care can be delivered to communities, families, individuals in a way that works for them! Exclamation point. This is true personalized medicine in my perspective. How has Prince George's community responded to your efforts to expand this model beyond COVID? Question mark. Do you think this is sustainable once COVID has come under control? That's the $1 million question, right, Gloria? The people are saying, yep, don't abandon us.
Exactly. It works, and it will continue to work because that we are in contact, we are in connection with the community. We're talking, we're speaking that language, plain language. Once again, we went with plain language and we got them hooked into this. And now this is the model. Once again, this is a model that can be replicated for anything.
And look what George said. The budget didn't get cut.
Yes.
Amazing.
And we have amazing leaders here that can make these things happen.
Okay, Dr. Quinn's trying to say something. Go ahead, Sandra. And put the poll up.
Yeah, so I think, you know, I'm going back now to what everyone has talked about and the recommendations. And you know, right now we have a county government that has equity as a focus. We have a brand new hospital, you know, that is just beautiful. We have doctors in Luminous, MedStar, Adventist. We have a lot of resources here. One of my questions, actually, I'm going to pose really to probably to you, George, because I think in your role as a public official, is how can these community groups, how can the people that want to see some of these efforts sustain to address issues of health equity, how can we help you make the continued case.
And George, while you're answering, we're going to put a poll up. Go ahead and put the poll back up. Go ahead, George.
Well, certainly one of the things is to continue our partnership and continue our communication. I think that's the first step. But also, I think you have a county and a community that believes in the data and believes in the science. Your ability to provide the data that will help drive my arguments and my advocacy for health and human services is invaluable to me. And it's invaluable because I have people that understand data and understand science. It wouldn't be, I remember getting asked a question when delivering a lecture to medical students in New York, and it was about advocacy. And the question was, well, what happens when science is no longer the currency of advocacy? When the science doesn't mean anything? Well, then you're in trouble. We're not in trouble here, and so please do continue to support us with the scholarly activity and scholarly work that's being done by the School of Public Health.
Thank you, George. And we're going to take that as your take-home message. I can't believe we're at the finish line. So continue the collaborations, continue the science, continue giving the community a voice. Joe, what's the take-home message tonight?
Yeah, I think the collaboration is the message, Stephen. I will emphasize the fact that we are an academic health system. It is important that we grow the next generation of public health professionals in this county. And what better platform than the work being done right now? And so I really want to echo what my colleague, Dr. Askew, has already said about collaborating around evidence and science, and frankly, building on the talent that is right here in our county.
I can't thank you enough, because many of our students are interning. And so even without a medical school situated right here, Deneen, we can train that next generation working in partnership with our community hospitals. Deneen, what's the take-home message tonight from you?
You know what? I'm going to stick to the theme. So, Dr. Wright, you are 100% right. Collaboration, staying connected. And I also think the focus on health and recognizing that our teams aren't just, we want more health professionals. We need public health professionals. We need clinicians, but we also need those with lived experience, those trusted voices in the community. They're all part of our team. And I think together we're there's nothing that we can't do. So it's all about collaboration.
All right, Dr. Quinn, take-home message.
I think that we have a strong foundation to work with. We have policies, legislation passed that can help support these efforts. We have willing partners in the county, and we have a willing public that wants to be engaged in this process.
And Gloria, as we close things out here, if I can find the right button, we had a poll. We'll just do this the old-fashioned way. Let you just vote in the chat. If you would like to stay informed and engage about these recommendations, please drop your email in the chat box. What an amazing evening we've had tonight, Gloria.
This is wonderful. And I just wanted to say that we have a blueprint now. We can follow this, and we have a set of recommendations that this can be done. And that connection with the community, that connection with those trusted voices, with those trusted organizations, let's keep it up. Don't miss this opportunity to create an environment that we want to protect them. I'm pretty sure that the hospitals here will not like to see too many people in their facility, because that means they are healthy. So that's what we're looking for.
And so, thank to all the public health and healthcare, health education, community organizations, the local government, Prince George's County, who have worked tirelessly to serve this community during the pandemic. And we encourage you, just put your phone camera to that QR code. It'll take you to the report. And Gloria, I could not be more pleased with our engagement tonight, the education we gave the community, and a sense from our panelists that this is not the end. This could be an ongoing conversation. And so my closing remark has to do with the whole mental health. I did not until tonight realize, until we talked it out, that mental health would be such a theme throughout so many aspects of our report, not just on the what we might call the patient or the community side, but on the health professional side, on our workforce. We've got to spend time there. And I'll leave you with something I learned today, Dr. Quinn, for all the panelists and the guests out there, from one of your faculty when we were talking about mental health and the stigma that comes whenever we say that word. She says to me, how about emotional health? And I think that Dr. Mariana Falcone is onto something. Emotional health, how we can help de-escalate situations as people are on edge, how we can help these families who have been traumatized by loss and grief. Let's find ways to have more acts of kindness with one another. And with that, can you believe it's 8:01? Thank you all. Gloria, did you have a good time tonight?
Oh, this was great as always. And thank you, wonderful panel, wonderful moderator, and wonderful. This is great.
Until the next time, be safe, keep your mask close, sanitize, and spread the word to get vaccinated. Bye-bye.
Bye.